Hi, let's talk about medical terminology. This won't take too long, but it's very important and you'll use it throughout the year. You're going to learn a whole new language and be able to communicate professionally. And with communication, that also means being able to read as well as speak and also to, of course, understand. So it's the language of healthcare professionals, but a true professional does not use this kind of jargon around lay people and expect them to understand it. It's very important to providing good care, and it describes disorders in the human body and ways of treatment and lots of other aspects of the field. There's decodable terms that can be broken down to determine their meaning and have more than one part. The decodable terms that really can't be broken down, they are what they are. And there's a lot of eponyms in healthcare because lots of people discover syndromes and things and they're named after them. So medical terms are often made up of a prefix, a root word, and then a suffix, or any parts of that. Could be two different word parts coming together. And sometimes there's transitions built in too. And we'll look at some examples. Trach means, the root of it is trach, meaning windpipe. Endo is a prefix that means within, so endotracheal means within. Ostomy is a suffix that means an opening, and so tracheostomy is an opening in the windpipe. Larynge is a root word that has to do with the voice box, so laryngotracheal is the voice box as well as the windpipe. And then we have a lot of root words. Cardio pertains to the heart, gastro pertains to the stomach, neuro to nerves or the nervous system, osteo to bone, OT to ear, my or myo to muscular, and arthra or arthro to joints. So the suffix ology is the study of, so cardiology is the study of the heart. Pathy has to do with the disease process. So gastropathy is a word that means there's some kind of pathology of the stomach or a disease of the stomach. Ologist is a specialist, so a neurologist is a specialist in nerves. Otomy is an incision into the bone, and so an osteotomy is an incision into the bone. A scope means to view with your eye, and so an otoscope is an instrument that looks into your eye. A muscle cell is a site. So myocyte is a muscle cell. And graphic often means that you've recorded some kind of movement, and so arthrographic would mean a recording of a joint. Or if it could be an image of too. Arthrography has to do with an x-ray of a joint. So some word parts have the same meaning, or there's two different words or roots that have the same meaning. So ocule and oph both have to do with the eye. Dactyl and digit are finger. Glyco and gluco are sweet or sugar. Test, orchio, or orchid has to do with the testicle. Mast and mammo both mean breast, and neph and ren both mean, or reen, both mean kidney. So you've got a couple different ways to say the same thing. So prefixes are placed at the beginning of the word and indicate location, time, or amount. We talked about the example of that being asymptomatic, without symptom. And the prefixes, some prefixes have more than one meaning. Of course, it can't be simple. So para means side by side. A paraplegic is motor or sensory loss in the trunk. Hemiplegic is half, one-sided half, and so a hemiplegic would only be paralyzed on one side of the body. Quadriplegic, quadri meaning four. Quadriplegic means that all four extremities are paralyzed. That's just some examples of that. And then suffixes are used at the end of medical terms to modify or change its meaning and often indicate whether the term refers to a condition, procedure, or a disease. So here's some more examples. The suffix oma always means tumor. So a neuroma is a tumor of the nerve. Itis is inflammation of, so osteolytis is inflammation of the bone. Megaly is enlargement. So, and hepa is always a prefix that means liver. So hepatomegaly is enlargement of the liver. Logy is study of. So otology or otology is the study of the ear. Pathy, like in pathology, it could mean disease So cardiopathy is a disease of the heart. AL or IC pertains to renal, so it pertains to the kidney because it has the rene at the beginning and then the AL. So rene, we just said in a previous slide, meant kidney. AL pertaining to. An osis, or abnormal condition, like kyphosis, is a abnormal curvature of the spine. So that just gives you a few more word parts to memorize. Medical terms and their parts can be organized into groups by what they identify. There could be body parts, color, direction, location, any of those. And here's a whole bunch of terms for you to look at, but these are the common terms. These are things you're going to want to know. You're going to want to know cardio is heart, cysto is bladder, hem is or heme is blood, mast or mammo is breast, neph or ren is kidney, oste is bone, and rhino is nose, like rhinoplasty is a nose job. And then for the colors, chlor is green, cyan is blue, leuc is white, like a leukocyte. Those are white blood cells. And melon is black. Chloro is like chlorophyll. You know that's what makes plants green. And cyanosis means a bluish color around the mouth. So you'll see those in medical terminology frequently. Now these terms are also pertaining to directions in the table 1110, very important. So medial pertains to the middle, or is toward the midline of the body. Lateral pertains to the side, off to the right lateral, left lateral. Proximal pertains to the near, or close to another body part. So my hand is proximal to my wrist. Distal means far, so my fingertips are distal to my shoulder. Anterior is the front of the body, and another term for that is ventral. And posterior or dorsal, like a shark's dorsal fin, pertain to the back. Inferior means downward, so I could have a gash on my ankle, and that would be inferior to my calf. And superior, I could have a gash on my knee, and that would be superior to my calf. And so those terms are used for a location. Also, endo, again, is from within. Epi is above, so epigastric pain would be pain above my stomach. Peri means around, so there's a pericardial sac, that's the sac around the heart. Retro is backward, and sub is under or below, like sublingual, under your tongue. So once you know these word parts and you know these locations, you have a much better understanding of what's going on and a much clearer way to proceed and to describe patient's symptoms and that kind of thing. You know, abbreviations are terms. Acronyms are abbreviations that take the first letter of each word and make them into a term, like BOCES, stands for Board of Cooperative Educational Services. And symbols are characters or images that represent something else. So there's just a few little symbols that you might not know, but you probably could guess some of them. Upward arrow is increase, a downward arrow is decrease. Then we have the symbol for Celsius, which is a temperature measurement. Plus sign is present, or means it's there, like present symptoms. Minus sign would be without or absent. There's a symbol for a female, the symbol for a male, and then P with a line drawn over it is after. So if somebody could have a medication after meals, you would see the doctor draw a P with a line over it. If it was before meals, it would be an A with a line drawn over it. So that's the quick 9-minute medical terminology overview. And you'll have these terms and the other content of your workbook and your textbook to memorize for your test. And so when you go out on rotation, you have a frame of reference for what you're seeing and hearing. So welcome to the Medical Language Club.